Hi, I'm Dr. Capone.
I'm Dr. Kirby Black.
I'm Dr. Radhika Martin.
I'm Dr. Ofrana Reed.
How was the vaccine developed and tested? Safety is the most important priority in vaccine development. Approval of a vaccine for use in people involves multiple phases that ends in the release of a safe vaccination. Phase 1 and 2 are focused on safety and correct dosage. Phase 3 continues to focus on safety, but also where efficacy is proven. Once a vaccination is approved for use after Phase 3, it has been tested on tens of thousands of people. If no significant harmful side effects are noted, it is considered safe for use. This type of clinical trial has been used for decades to approve medications and vaccines. To ensure we could have a safe vaccine as quickly as possible, an emergency use authorization was granted.
What is an emergency use authorization? An emergency use authorization, or EUA, for a vaccine is based on the need to use a vaccine quickly to save lives during a public health emergency. EUA is a shorter process, but no steps are skipped in the safety evaluation process. The FDA will assess if the potential benefits outweigh the risk. 2 separate advisory boards will also review the data and make recommendations. An EUA does not imply that the authorization was done too quickly or that the vaccine is not safe.
How was the vaccine developed so quickly? There are multiple reasons for this. First, the sequence of the genome was identified very early, making it rapidly available to scientists to study. The world's resources were all diverted to this single task. This was a global effort, including all of the world's leading scientists. Nearly unlimited resources, money, knowledge, manpower, and technology were poured into this effort. At the same time, we also had a large pool of diverse adult volunteer trial participants because the disease was so prevalent. All of these factors contributed to expedite the development of the vaccine. How will we know it is safe? To assess safety, the FDA typically advises that a minimum of 3,000 participants are included in the trial. The current COVID-19 vaccine includes 30,000 to 50,000 participants. Most side effects occur within 6 weeks of vaccination. To be more cautious, the FDA required 8 weeks of safety monitoring of the COVID-19 vaccines post-vaccination. In addition to the FDA, many independent bodies and scientific panels have also studied the data to ensure safety. You can refer to the links posted below to see for yourself. The monitoring for safety will continue as the vaccine is distributed to the public. What are the side effects? Up to 1 in 10 people will have short-term discomfort, fatigue, headache, muscle pain, chills, fever, and pain at injection site after vaccination. These reactions typically last for 24 to 48 hours and can be more pronounced usually after the second dose. Side effects are actually a good thing. It means your body is doing its job and making antibodies. These side effects are normal, common, and expected. You will not get COVID-19 from the vaccine. It's not possible because the mRNA vaccines don't contain the COVID-19 virus.
So what is mRNA and how does it work? Messenger RNA technology, also known as mRNA, has been studied for over 10 years and is already being used in cancer treatments. COVID-19 mRNA vaccines give instructions for our cells to make a harmless piece that looks like the spike protein that's found on the surface of the COVID-19 virus. Our bodies recognize that this protein should not be there, so they build antibodies that will remember how to fight the virus if we are infected in the future. So remember, mRNA vaccines cannot give you COVID-19, and they cannot and do not change your DNA in any way.
What if I have allergies? There's been much discussion about severe allergic reactions to the COVID vaccinations. The reality is that allergic reactions to the COVID vaccine is very rare. The vaccines themselves are each relatively simple: the mRNA molecule, a lipid coating, and some stabilizing agents. The Moderna and Pfizer vaccines are preservative-free. All of the components of the vaccines are listed on the CDC and FDA websites. Please check the ingredients or discuss with your doctor if you have a history of severe allergic reaction to medications in the past.
When and how long will I be protected by the COVID-19 vaccine? The two vaccines available now are both 2 doses, 3 to 4 weeks apart. Protection occurs 1 to 2 weeks after the second dose. At this point, we don't know how long the vaccine will be protective once we receive it. It is possible we may need to have vaccine shots for a COVID-19 on a regular basis like we currently do with the flu shot.
What if I already had COVID-19? It is safe to get the vaccine even if you had COVID-19 already. In fact, it's important that you still get vaccinated even if you have recovered from COVID because it could give you longer, better protection against contracting COVID a second time. If a patient has been diagnosed with COVID-19 greater than 10 days ago and has been asymptomatic for 24 hours or more, the patient may be vaccinated. Where can I get accurate information? Unfortunately, social media is rife with misinformation and opinions based on that misinformation. It's important to do your own research, but it's just as important that you use reliable sources. Review the research and recommendations from well-trusted sources with experience and scientific expertise, like the CDC, AMA, medical directors, and your trusted providers. We'll link to a few of these sources so you can check them out for yourself.
So, should you get the vaccine? Yes! COVID is the most contagious, deadly disease we have encountered in modern medicine. We've been battling this pandemic for many long months, and our society has suffered enormous losses. The vaccine is the biggest hope we have yet in fighting this scourge on the world. Even if you are young and healthy, there is still a risk of death due to COVID. The older you get, the more medical problems you add on top, the higher this risk gets. The vaccine does have costs: time from your day, minor discomfort, and an extremely low risk of complications. The benefits of the vaccine are enormous. It will save lives. It could be my life, or your life, or the life of someone you love. Ultimately, this vaccine could mean the return to our normal way of life.
I already got my first dose of the vaccine.
I'm getting mine tomorrow.
I got my first dose at 7 o'clock this morning.
Are you getting the vaccine?